Welcome to Section 2 of Chapter 6. In this section, Todd will review the specifics of the contract with you and redline various sections as we work through the contract. Remember, it is acceptable to print off your contract and write in your changes when you redline your copy. If you haven't done so already, we suggest that you pause this video and print a copy of the sample contract in the worksheet so that you may follow along.
So now we're in Section 2. We're going to look at the specifics of this contract and some areas that you want to pay particular attention to. The first one is covered services. What is a covered service? Remember, not everything is a covered service. In this particular clause, it talks about the member's contract as issued by the plan. You're signing a contract describing covered services that are described on a document that you don't have. So you might want to ask a payer for one of those contracts. It'd be a great question because you're saying that you understand what they are. So responsibilities of the provider. Pay particular attention to this, and you'll notice usually what they say, and this is okay, this is pretty common, it just describes that you are going to treat every patient the same way. You're going to treat every patient with respect. You're going to, no matter what they are or where they're from or anything like that, you're going to treat them the same way. That's okay. Just be sure that you read it and that you understand it. Section 2, subsection B, there is a description of the criteria of the provider. And in this particular contract, it discusses not just the primary provider in your practice, but maybe the mid-level provider, the APP in your practice. How are they attached to you? What are their criteria in terms of being a provider for that contract? This is all okay, but make sure that you understand it.
Personnel and provider criteria is an important section as it relates to behavioral health providers. If you have behavioral health providers in your practice, make sure that they are included in this criteria and verify this with the health plan.
Be sure that your behavioral health provider will fit into this criteria. If it doesn't, you're going to want to say something to the health plan. You're going to want to point that out and say, in Section 2, subsection B, I need to know how my behavioral health provider fits into this. Still in Section 2, there's a section usually in every contract that discusses how locums work. So if you are on vacation, you're a small practice, you go on vacation, you have a locum tenens come into your practice, there's some discussion of how that works. Also in the contract, you'll find a section here, it's in Section 2, that talks about that you should be free to speak to your patients. In other words, the health plan can't tell you what to say. They can't prohibit you from speaking freely to your patients about treatment options. And that's usually documented in every contract. Every contract has a section that talks about medical records. In the section, there'll be some documentation about how they can have access to your medical records. They might even have a section that allows them to have ability to see your financial records. That would be one of the areas where I would ask them for their intent. Why is it that you want to see my financial records? In this particular contract, it says that the plan shall have the ability with 72 hours notice to come and inspect your records. If that's reasonable, it's fine. If it's not reasonable, you need to highlight it and talk to them about it's not reasonable. Still on page 6 of this contract, there's this clause that says the provider will afford plan opportunity to access all records and reports and other documents necessary for the plan to monitor the capacity and the legal authority of the payer. This would be a great section that I would highlight, and I would go to the health plan representative and ask them why. What is their intent with this section? Doesn't mean I don't agree to it. I just want to know what they mean by that. I don't like the word all. You might want to ask them to give you a specific list of things that they can see. On page 7, section L, there's some documentation about notices to the plan. This is important, and something like this will be in every single contract you have. This particular clause says that if the provider in your practice, if one of the providers has some legal issue, that you have to tell the health plan what it is. So if there's a bankruptcy, somebody gets arrested, anything like that, you have to give notice to the health plans. You're going to want to really take particular attention to these kinds of clauses. Every contract will have a discussion in it that talks about termination. What happens in the event that the contract, for any reason, terminates, ends? Pay particular attention to this section because you may have to continue to see their patients until they can find somebody to replace you. You may be in a situation down the road where you want to have a different contract. And so you're going back and forth with the health plan. If the health plan can keep you on this agreement going forward a few months, or even quite a few months, you might want to double check that section to be sure that's fair. So in this particular contract, they call it plan post-termination responsibilities. They also go on to really getting into the details of how you work together after the termination of the contract. On page 8, the contract is requiring the provider to arrange for the patients going forward. So in other words, you've terminated the contract, and then they're telling you that you have to help the health plan make sure that the patients have another provider to go to. That may be okay with you, and that's fine, but just make sure that you understand what your responsibilities are. So now we're on section 3, the responsibilities of the plan. Just as you read your responsibilities, the responsibilities of the provider, you want to make sure that you read the responsibilities of the plan and be sure that they're fair and that they work for you. I think these are okay. You just need to be aware of them. This is on page 8, section 3. Dispute resolution. Be sure you read this because typically, in almost every contract I've ever seen, there's an arbitration clause. So in other words, you guys don't want to end up in court with each other, that there's going to be an arbiter. Section 6 is payment and billing. This is where there's going to be a discussion of rates. This is really important for those practices that have behavioral health. You want to make sure that somewhere in this contract, and it might be in this section and it might be in the rate page, that your behavioral health providers have some mechanism to be paid. In this particular contract, under payment and billing, I found a sentence that I don't really understand. I had to read it like 3 times. So, provider agrees that the payment rate for any particular service offered under this agreement will not exceed the lowest rate for that service which the plan previously negotiated and agreed upon with the provider. And it goes on and on. I don't understand that. And I would say to it, this is an area that I would redline, and I would go to my payer representative and say, in section 6, on page 9 and 10, explain to me that sentence and tell me what you really mean there, because this is kind of legalese, and I want to make sure that I understand it. In every contract, there is some discussion about how the patient can be identified by the practice. A lot of times they'll give you a sample of the cards, what they look like. I would ask for that. I would ask for a sample card. In addition, on this particular page, and I'm on page 11 of your contract, there's a discussion of liability. Be sure you read that section. They don't want to be liable for what you do, but at the same time, it should be equal. You should not be liable for what they do. Now I'm on page 12. In section 8, they talk about non-exclusivity. There are contracts, it's very rare, and it depends on where your practice is, where you could have exclusivity. That might be something you talk about, depending upon where your practice is and the specific things you do. There's another section on term and termination. Term and termination is a big deal in a contract, how it ends. Make sure you understand these. I don't really have any trouble with this contract, with the language in this contract, but be sure that you understand it, because you might have an issue with it. It's very common in contracts that it is a 1-year contract. However, it has a evergreen clause. There's a clause that says that this contract will go on and on and on forever until you stop it or until you have a new contract. Watch for evergreen clauses. On page 17, there's a rate sheet. It's called Exhibit 1 and Description of Services and Specified Rates of Coverage or for Coverage. We did not include an actual rate page in this discussion because we're really not allowed to talk about rates. We don't want to show someone else's rates. Your rates are your rates, and somebody else's rates should have nothing to do with what yours are. You want to make sure that you're being paid properly. Make sure that your costs are covered. Make sure that you understand the rate page and how it works for your particular practice, including how they pay for behavioral health. Make sure everything you do that you believe should be a covered service has a rate and a rate description so that you can, after the contract is signed, maybe a month out, after claims start moving through the system, you can make sure that you're paid properly. And we really suggest that you do that. It is not uncommon, it's not super common, but it's not uncommon that contracts are loaded improperly. So you may have signed a contract and then come to find out later that they're not paying you based on the contract. So a month or so out after signature, after the claims have started to move through, audit your contracts, look at your rate page, be sure that you're being paid based on the contract.
You may review Chapter 3 of this curriculum for more information on contracted rates and how to calculate your reimbursement. One final thing to remember, every contract will be different, depending on the payer you are working with. The elements of commercial contracts are standard for the most part, but each contract will be different. Do not be intimidated by these contracts, and make sure you review each agreement carefully so that it works best for your practice.